already have contraceptive care. We already have health care on the books today. In fact, just yesterday, the Ohio Department of Health director wrote a letter specifically stating this is misleading, this is false information. Doctors across Ohio have stated we have protections for health care. We have contraceptives, we have anything that a woman needs, including miscarriage treatment. So the other side is just peddling fear that is unnecessary. Whether you're pro-life, pro-choice, or somewhere in between, I'm with you on this. This ballot language does not protect us. This ballot language allows for painful late-term abortions when a baby can feel pain, and science tells us that's 15 weeks. It doesn't allow for parental notification or consent. So your daughter can go get an abortion with their rapist. It happened. Remember the soccer coach that I shared with you? 14-year-old was forced to get an abortion so that rapist could cover his crime. We absolutely have protections in our law today for women. The fact that the ACLU is peddling misinformation about contraception, which is available in Ohio, miscarriage care, which is available. And I can tell you, I gave birth last year to my son, and in between, I thought I was having a miscarriage. I went to Riverside Hospital. They gave me the proper care, and thank God my son was born. But to peddle misinformation, you don't have to hear it from me. Go ask your doctor. Do I have contraceptive care? Do I have miscarriage care? We have to start telling the truth about this. We have to protect parental consent and children. We have to vote no because our moral compass and our families are at stake today. This is too extreme and radical. Governor DeWine just launched an ad. He studied this amendment and said this is too radical for Ohio. So I urge anybody to look at this amendment. This is not just about abortion. It's about much, much more. And if it was, they would have used the word woman. They would have defined viability. They did not. I think every Ohioan should know that the ACLU wrote this amendment. It was very deliberate. And let me read to you, every individual has a right to make its own reproductive decisions. They didn't write every woman. Individual means man, child, it could be anybody. Why didn't they use the word woman? They refused to answer that question. Again, if we want to have these in-depth discussions about abortion, let's have them. But this amendment, it stops all of those discussions and it eviscerates our health and safety standards. Today on the books, if you're going through some traumatic reason for going through an abortion, you have to be affiliated with an ambulatory facility. We would get rid of that. God forbid there's an emergency. What does that woman do? 24-hour waiting period. When I go see my doctor today, because I am 7.5 months pregnant, they always keep me separate from my spouse and say, is there domestic abuse at home? Guess what? That won't exist anymore. Why are they so anti-woman? Why are they so anti-protecting what is so sacred today, which is our families and our youth? I don't understand it. They had every opportunity to write a clear amendment, and they didn't. This allows for abortion past viability. This allows for the abortionist to determine when to terminate a pregnancy. And at 15 weeks, when a fetus can feel pain, that is not acceptable. That's not where Ohio wants to be.